So physical therapists typically learn about 3 or 4 slides worth of information about hypermobility, and most PTs would say that they know how to treat hypermobility, just have the patient not go through their hypermobile range and stay within the normal range. But that's actually not correct. There's some research that's showing that working out throughout the full range the patient has gives them better control and confidence and less pain. So there's a lot to be learned about hypermobility and how to actually modify one's practice around it. And unfortunately, physical therapy programs are not teaching this at this point. They could teach more about the current research and evidence that's been collected on this condition. They could teach more about specifically chronic pain, and I would say some programs are teaching about chronic pain, but people with hypermobility do have a higher chance of developing a chronic pain syndrome, and so learning to break out of that is really important. I would say some therapists that learn about chronic pain learn that it's basically a neurological condition and we need to repattern the brain. And then they'll ignore the actual physical subluxations that are going on, assuming that it's just the brain providing inappropriate pain messaging, when there's actually both things going on for a lot of our hypermobile patients. The joint is truly subluxing and not tracking correctly, and the brain has gotten hypersensitized and it feels every little thing that's off as pain. So treating both the neurological hypersensitivity to pain as well as the actual joint alignment, tracking and position, and the imbalance of muscle firing that gets set up needs to be treated. So we can't take either an orthopedic approach only or a pain neuroscience approach only. It really has to be both put together.